Okay, I'm gonna get started now. Like I said, thanks so much, everyone, for joining us today. This is the Coaxis platform's first webinar, so we're very excited to host today's webinar alongside JPAL. And today's webinar will spotlight impactful solutions working at the intersection of climate and health. This will be the first of what we hope will be many more webinars and events organized with thought leaders like JPAL to highlight the opportunities in key sectors and areas of interest for philanthropic funding. Before we jump into the webinar agenda, just some housekeeping matters. You may, and we actually encourage you to turn on your cameras if you can. Just please keep your microphones off. The Q&A function is enabled, and that's for you to put in your thoughts, comments, any questions, or even to introduce yourselves to one another and to the speakers as well. And finally, just a note here is that we will be recording the webinar and also taking some photographs and screenshots as well. So if you have any questions about that, you can reach out to the Coaxis team. Okay, without further ado, I'd like to invite Jocelyn Ong, who is head of Coaxis, to properly introduce the platform to everyone. Over to you, Joyce.
Hi, good afternoon, everyone, and thank you for joining us today. Just a quick recap on the platform. I'm very happy to have all participants today at our webinar. We're bringing together some of our opportunity owners that will be showcased later through our proposing partners. We also have our partners in knowledge and thought leadership, JPAL, as well as financial institutions, philanthropists, and family offices who are potential capital providers. So setting the stage for us today, just wanted to quickly say that action is urgent on our side where climate is concerned. We are off track for 2050 net zero targets, assuming that we hold the temperature increase by 2 degrees. We will still need a 64% reduction in greenhouse emissions, and to limit temperature increases to 1.5% by 2050, we need 84% in reduction. What will happen if we do not take urgent action? We will be at the Earth's tipping points. Ice sheets in Greenland and permafrost may start to melt. Surpassing 1.5 degrees, we will have the boreal forests, mangroves, and seagrass meadows becoming vulnerable. And at 2 degrees, global warming and beyond, the Amazon rainforest, subglacial basins in Antarctica, and the will be triggered, as well as we will see the irreversible collapse of the Greenland and West Antarctica ice sheets. Without further ado, I'm going to hand back to Erin to introduce our partners from JPAL to further dive into this topic. Thank you.
Yeah, thanks so much, Joyce, for introducing Coaxis and for setting the scene. Before I introduce the first speaker, maybe just to give a quick overview of what you can expect from today's webinar. So as Joyce mentioned, you'll be learning from JPAL experts who will be sharing case studies of social innovations who have great potential to achieve impact in the area of climate and health with the right support. You'll also get a chance to hear from 2 impact opportunities on board the Coaxis platform who are actively working on the ground to help marginalized communities better achieve, climate and health outcomes. And finally, through an interactive discussion with all the speakers we have today, we'll do a deep dive into impact methodologies and how to level up these standards for funders and investors. Okay, so with that, I'll stop sharing my screen and invite our first speaker, Andre, who is Senior Policy Manager at JPAL's King Climate Initiative, to introduce JPAL and to take us through the first segment of today's webinar. Over to you, Andre.
All right, great. Thank you, Erin. Thank you, Jocelyn, for introducing, setting the scene. And we're so honored to be part of this first webinar. It's a really exciting initiative that you have, and very, very important topic of climate and health, as you already started discussing. So, as Erin said, my name is Andre Zollinger. I'm a Senior Policy Manager at the Abdul Jamil Latif Poverty Action Lab that's based at MIT, at the Economics Department. I'm joined by my colleagues Harris in our SEA office in Jakarta and Sham at our South Asia office in Delhi. And we're here today because we think that, climate change is a topic that is affecting all areas of international development, social entrepreneurship, and one way to talk about tackling climate change that, frankly, is not often, it's not done often enough, is to think about it from the lens of the health effects that are very, direct on populations and might actually be a very productive way to, spur climate action. But before we dive into that topic specifically, I want to introduce JPAL in our environment work. So what is JPAL? Why do we work with climate environment? And then after that, Harris and Sham are going to dive into specific examples and case studies from our research portfolio. So JPAL is first and foremost is a network of researchers. It was founded in MIT's economics department in 2003, so over 20 years ago, by Nobel laureates Abhijit Banerjee and Esther Duflo. And JPAL is um, also now it started at MIT, but now it's a network that grew to more than 1,000 researchers, over 100 research universities all over the world, and with a mission to combat poverty by informing policy with scientific evidence. So the idea is that in economics departments, there's a lot of, increasingly rigorous research being done, and I'll talk about what we mean by rigorous research. Um, but that research a lot of times just stays in economics journals or academic journals. And so what we do, Sham, Harris, and I, and our colleagues do, is we work with this research network to make sure that the research gets translated into actionable insights that policymakers, social entrepreneurs, companies, and others can use. And so this is just a small sample of some of the universities that we work with. And these are the regional offices. I mentioned SEA, South Asia, but we also have a presence in many other places as well. And all of these offices work with, make long-term relationships. They are all based at local universities around the world, and they drive our research and policy work by building the partnerships, the relationships with hundreds of governments, NGOs, philanthropies, um, and private sector organizations to make sure that our work is responsive to real world priorities. And so, what do we mean by rigorous research? I think the thing that drives together our network is randomized evaluations, which are basically, you know, research studies on the field inspired by medical trials, where it's a method that helps evaluate impact of a particular policy or a program, the impact on people's lives. And so when it's done well, we can answer questions about did the program achieve its intended impact? Why or why not? And the reason is because we have a group that receives that intervention, a group that we just observe, and the groups are randomly selected so that they have similar characteristics, and the only difference between them is the intervention. So when a randomized evaluation is done well, we can have a very good idea of the causal impact of a certain policy or program. And so today, our network and research has worked on hundreds of NGOs and governments to conduct over 2,200 randomized evaluations in over 80 countries. And we have a lot of that knowledge, kind of that knowledge bank is available on our website with summaries and insights of all of these evaluations. And so, as a center devoted to poverty reduction, why do we work on climate change? So actually, climate and poverty are deeply interconnected, and we recognize a fundamental inequity at the heart of the climate crisis. People who did little to cause climate change are actually going to be and are already being disproportionately harmed by it. And so both because the places where they live, right? Because they're places that are often hot and are getting hotter. And so they're facing extreme weather. And then also they're a lot of times the people who have the fewest financial or other resources to adapt to the different challenges brought out by climate change. And so what we see in the climate space is that there is a significant amount of funding and innovation going into understanding the climate science, the tipping points. There's also a lot of investment going into new technologies, which are absolutely essential for a climate transition. And kind of where we fit in is in between the two, because we see that there is lack of knowledge, or maybe there's an opportunity to understand more about implementation. So once you have a technology, a new idea, a new policy, how do you actually implement that to the best, optimal effect? And I think that's the space where randomized evaluations can come in and be really helpful. And we're going to talk about that in some of the examples. And I'm just going to go very quickly on um, the high level, what we've done so far. So through the King Climate Action Initiative, which is our flagship research and scaling initiative to combat climate change and poverty, we have funded a number of evaluations, and our approach is to start by, identifying climate solutions, designing um, between NGOs and researchers. So we match researchers with an implementer, whether that's a social innovator, social entrepreneur, a company, a government. So we start with that step. We go on to testing, so conducting these kinds of rigorous evaluations. And then once we know that something works, we actually fund scale up, and we help form the partnerships that will scale things up. So we'll talk about some examples of that. And so far, just to give you a sense, we funded more than 80 research projects. We've had results already. We've existed, as a fund since 2020. So this is in the last 5 years. And we've been operating in 40 countries in these focus areas, which are very broad on purpose because we need solutions for all of these areas. You'll notice that we also look at pollution reduction and how, and I think that's a big area in terms of climate change and health. We can talk. And again, I want to remind you that we don't do this alone. We do this with partners. And so I think that's one of the biggest strengths of our model is that we work in a decentralized way with these thousands of researchers and top organizations. And hopefully the things that we're learning is not just staying in our website, but it's actually being used by all of these groups and more. And what we've analyzed so far is that when we, for every dollar that we've spent in KCI, we've had a return of $48 dollars in climate benefits and co-benefits. So when you think about the carbon abated or the health benefits, we've actually calculated the total so far, and this is a very conservative estimate because we don't have results for all of our projects. But out of the few that have had returns, and when we look at how people protect themselves and lower mortality, lower disease burden, we actually have quite significant impact estimates just from our first 5 years, including the number of tons of CO2 abated, which if you translate to dollars, right? If the social cost of carbon is $190 per ton of carbon, so that would come out to about $23 billion dollars. And we've reached where every year as the research becomes more mature and scales up, we're reaching more people and we're going way beyond the already ambitious goals that we had when we started the initiative 5 years ago. And then the last thing I'll say is that our model is not only, funding research to the whole network as we do with the King Climate Action Initiative. We're also starting specific labs in countries where we have long-standing relationships. So Sham from the South Asia office works on the Sarwa lab, which is based in Delhi and works with the Gujarat Pollution Control Board and another government agency in India. We also have labs that are working specifically with private companies. So we have another lab that's not on this slide. But the idea with that is that we can also partner with specific organizations and fund co-creation of research between a government agency, a large company, and our network of researchers. And this is a model that we're quite excited about moving forward with our work. But now I want to turn to my colleagues and have them, present themselves really briefly and give us some examples of the impact case studies that we've had so far. So thank you for listening. I'll pass it over to Harris.
Thank you so much, Andre. So when we work with private sectors and any partners, really our mission is to make sure that policy or program design, as what Andre already mentioned, is informed by evidence, right? And we try to find pathway to multiple impacts. In this opportunity, I'll be showcasing some of the project's portfolio from the SEA office. Now, the projects I'm about to share with you are really concerning with air pollution, or really notably known as one of the silent killer. When we see the stats globally, air pollution contributed to 7 million deaths annually due to a lot of non-communicable diseases linked to exposure to air pollution. You can name it: cardiovascular problems, lung cancer, strokes, and the list sort of goes on and on and on. And if you look at the recent estimation, in Indonesia alone, diseases linked to air pollution can cost the government up to $28 million. That is equivalent to 3% of our GDP. While a lot of efforts to sort of tackle pollution at its sources continue, we really need to think about solutions that can minimize the health implication of being exposed to pollutants. And one of the potential cost-effective ways to do this is to promote the use of air filters, protective tools, especially in areas where the level of pollutants is considerably high. Can you move to the next slide, please? All right, the first one is the project from home, really, from Jakarta, where the level of pollutants, if we look at the recent data, it's been increasing almost 166% compared to last year. And with the recent WHO estimation, life expectancy is also predicted to get shortened if the current level of pollution persists. So JPAL researchers really worked together with one of the solution owners, startups, to investigate whether renting out air purifier for free and bundled it with air quality monitors, also adding an additional components, short films about the impact of air pollution and ways to protect family members, can really increase the adoption and usage of air purifiers in middle-income households. Next, please. Now, similar projects were also carried out in neighboring country, specifically in Dhaka, Bangladesh, with the only difference is that the intervention also provide electricity compensation, right? Just also take a look if it stimulates the usage of air purifiers. The question is what makes these two projects interesting. So both projects try to answer two essential questions. First one is, do households have prior misconceptions about the actual level of pollution that they're actually experiencing in their home with how they originally perceive it? The second interesting questions that researchers ask is trying to understand whether clean air is an experience good. It means uncovering whether if households get a first-hand experience inhaling clean air in their houses, does that experience stimulates more adoption and usage that will eventually protect them from exposure to pollution while they're at home. All right. Can you move to the next slide, please? Thank you. Now, there are at least three interesting key insights that we can take away from these projects. The first one is at the baseline, researchers from both projects really discovered that households underestimate their own pollution exposures. What does that mean? It means that there's this incorrect belief about the severity of indoor air pollution, the actual severity of indoor air pollution, and they also seems to have misperception about the effectiveness of air purifiers. From the study in Dhaka alone, fewer than half of the household had an opinion on air purifier effectiveness, and less than a third believed that purifier removed more than 25% of air pollution from the rooms where they were used, right? Which really contrasts very sharply with the actual effectiveness of air purifier, 80% in real household environment. Now, moving on to the second lesson. Now, because the intervention was bundled, right? It's really interesting to take a look at, each of the components. If you bundle it, does it work better? And I think the second lesson that we can take away is that providing household with the monitors can really help correcting the misperception that happened at the beginning. So, and also help them to understand their health risk better. So households who receive air quality monitors were found to be 32% more likely to believe that the air in their home were severely polluted compared to the household without monitors, right? And I think another interesting key takeaways that I would like to share is providing air purifiers alone without the monitors, right, does not change household usage. Even when researchers already compensated them for the electricity cost to operate the purifiers, it happens that the researchers discovered household only use the air purifiers for less than 30 minutes per day, which is not enough, considering the level of constant PM 2.5, pollutants in their living quarters. The last key takeaways is bundling purifiers with monitors really increase usage, right? It can goes up to 270%. And researchers also discovered that household who receive both monitors and purifiers, they increase the price that they are willing to accept to sell back the air purifiers. There's a higher willingness to, purchase the items if you bundle these two tools together. Next slide, Andre. So yeah, Indian air filters is just really the tip of the iceberg. And there are a lot of areas that remains untapped. We are still experiencing inadequate waste handling, right, in Indonesia, where waste burning is really prominent in rural areas where waste services is not available. I think in next, Andre. I think in the transport sector, we're also still in dire need for better emission controls. And the last one is in terms of improving monitoring, more sensor is needed. I think in Jakarta alone, we only have 5 to 6 reference grade air quality monitors, and that is not enough. Right, so lastly, I think at JPAL, we push for innovation to be scaled up. If those two projects that I just explained could really be scaled up and generating a lot of interesting insights, there could be around 34 million people who can get reached by the policies, right? We always think about broader scope of collaboration between innovators and direct implementers. And testing these interventions can really generate a lot of interesting insights. I think when it comes to making decision, for example, about whether to roll out free product trials at the beginning of marketing planning, right? It can really incur a lot of cost. Analysis like willingness to pay can estimate the maximum price that consumers is willing to pay. And, this is a head start to take a look at the specific market segmentations. So that would be it. Examples from Southeast Asia. I'm going to hand it over to my colleague, Sham, who will be sharing more examples from exciting collaboration in South Asia. Over to you, Sham.
Thank you, Harris, and Andre as well. My name is Sham. I'm a policy manager at JPAL South Asia, where I lead the sectors of agriculture, environment, and climate change. So JPAL South Asia is the oldest regional office at JPAL, and we have evaluated several interventions to address major challenges that South Asia particularly faces due to the unequal impacts of climate change. In particular, today I wish to touch upon a couple of studies on adapting to floods. Now, communities across the world are at risk of facing increased likelihood of extreme weather events. In many places, floods can cause serious damage and can significantly impact health outcomes, especially through the spread of communicable diseases. It can also affect livelihoods, especially in lower and middle income countries where a large proportion of the population is dependent on agriculture. What are some of the solutions to reduce these impacts on health and agricultural yields? Next slide. Thank you. So, one such study is that in partnership with Google, JPAL affiliated researchers Rohini Pandey and Maulik Chandani conducted an evaluation of community-based dissemination of Google's flood early warning systems. This is based on an AI model that forecasts floods, and when a flood is predicted, the water level at each location is estimated, and an alert is sent to all smartphones in an affected area. Additionally, community volunteers are also trained to disseminate warnings on flood preparedness and resilience. Our early research from the study shows that participating households actually receive much more accurate results, and households were more likely to take action to protect themselves before floods, as a result of which they experienced 16% fewer flood-related illnesses and injuries, and ending up spending 30% lesser on healthcare. This evidence, next slide, update. This evidence informs a much larger scale that is happening across the Ganges-Brahmaputra River Basin as well as beyond, where our researchers are partnering with the International Federation of Red Cross and Red Crescent Societies to reach more than 500 million people in South and Southeast Asia in the next 5 years. And so you can see on screen how there are multiple ways in which we are leveraging our existing connections with governments in South Asia in order to build capacity of the governments to be able to implement this intervention, but also to set up the infrastructure required for disseminating these warnings. And the next study that I want to talk about is where researchers partnered with, next slide. Researchers partnered with the International Rice Research Institute to evaluate the impact of a flood-tolerant rice variety called the Swarna Sub-1 on crop yields and farmer behavior in the state of Odisha in India. Now, in this region, a lot of the farmers grow paddy, and floods end up destroying about 30% of the crop, as you saw in an earlier slide. So this particular variety of seeds helps in improving the tolerance of paddy to floods. What we saw was that during flood years, the adoption of this improved variety of rice actually had a clear advantage over traditional varieties, leading to dramatic reduction in yield losses and increased farmer revenues by about $47 per hectare. And access to this variety also led farmers to invest more in their farms. By cultivating more land, using more fertilizers, using more labor-intensive planting techniques. In a sense, what happened was that the sort of fatalism that affects a lot of farmers, thinking that they are at the mercy of the vagaries of weather, that got removed, and farmers felt that they now have control over what they can do in terms of affecting the overall productivity and outcomes. So they invest more. And these investments led to much higher rice yields and profits, even when no flooding occurred. Next slide. Now, responding to West Bengal government's demand for practical insights from the evidence that we got from this intervention, our researchers are working with the government on designing tolerant seed trial packet distribution programs. So how do we actually increase the adoption of these seeds among farmers? One way to do that we found is if we partner with the agro dealers who sell inputs to farmers, because farmers not just purchase inputs like fertilizers or seeds from them, but they also receive agricultural advice. So how can we target the information in a way that can, maximize the adoption of climate resilient technologies? We have our researchers working on that to help improve adoption and thereby climate resilience. So far, multiple free seed packets have been distributed, but this is going to be integrated with much more larger scale programs. So these are a couple of studies that I want to highlight from the South Asian context on adapting to floods. But we also have many other studies, including on air pollution, where we've set up the world's first emissions trading scheme on trying to reduce particulate emissions from industrial clusters. We are also working to scale up a new study which showed that making minor technological and operational changes to the working of brick kilns can dramatically reduce carbon emissions as well as other air pollution indicators, and thereby actually increase the profits of the brick kiln owners. And we've seen massive support for that among governments as well as industry associations in India. We're looking to scale that up, and as well as other very interesting studies that we can speak about through the book. Thank you so much.
Great. Yeah. Thanks so much, Shyam, Harris, and Andre for your insightful sharing and for highlighting some of the critical challenges in the region that need effective interventions. We'll bring the JPAL speakers back for the last segment as well. But for this next segment, we will be spotlighting organizations who are on the ground now, working on advancing, positive climate and health outcomes. I'd like now to introduce the first speaker of the two COAXS opportunities who will be presenting today. So we're joined today by David Pong, who is CEO and co-founder of Water Roam, which is a social enterprise that aims to improve the livelihood of every individual through clean access to water. Over to you, David.
Thanks, Erin. I hope you can see my screen.
Yep.
Cool. Yeah, thanks to COAXS and JPAL for the invitation. Glad to be here. So my name is David, as Erin has mentioned. What we have been doing since 2014 in the last 10 years has been really to focus our efforts in solving the world's water issues, or at least to tackle many of the communities here in Southeast Asia. So we started off the journey going around places in Southeast Asia and taking photos of where communities are getting their water sources from and directly drinking from. And this is the reality that we see, as much as many of us might be staying in places where there's direct access to clean drinking water. I think where we are really impacted most is when we see communities, especially children who are affected by this situation, causing them to not be able to properly attend school, having a lot of illnesses, waterborne illnesses that would affect them in their day-to-day lives and eventually lead towards affected livelihood situation in the future when they are not able to attend school properly. So my team decided to do a more in-depth study of what is the issue regarding this problem, and why is it in the 21st century we still have a big major water problem? Is it that there's a lack of solutions out there? And then we realized, as we were analyzing the entire scheme of things, and we realized that there is no lack of solutions. In fact, there are many different kind of solutions, but the challenge is that many of these solutions are more catered specifically for urban environments or small scale deployments. So for example, in Singapore, if you're urban city, you have pipelines, solutions, centralized treatment plants that can cater a large scale of clean drinking water across pipelines network to the entire city of few million people. But this is the issue when populations are rural, scattered in many places, and it takes too much cost and capital expense to lay pipelines over. There are many other kind of solutions, smaller scale solutions like traditional water filters, which tend to be much more slow and lower in water quality, or even bottled water, which seems to be what is a very simple, quick fix to the issue, but it turns out to be very expensive. So let me give you an analysis on the costs. So in Singapore, on average, a household income is about 8,000 for a average family size about 4 people, consuming about 150 liters per person per day. That leads to an 18,000 liters per month. And yet an average household like this would spend just $35 per month for their water bills, and that works out to be just 0.4%. In comparison to a rural household in Southeast Asia, in particular, this one I'm taking from Cambodia, let's say an average of four people as well, their household income may be $200 per month, and they're using 10 times less the water because they're not using clean drinking water to be flushing down the for their toilet bowls or using it for their shower. And yet we're looking at them spending anything from 1.7% all the way to 36% of their income. The UN has a affordability index, which is if the amount spent is more than 3 to 5% of household income, that means that it's considered not affordable. So we see that many of these existing solutions, if people from such communities really want to have adequate clean drinking water for their day-to-day needs, they would spend something up to 36%, and that's quite unimaginable, which is why we see that this is such a prevalent issue out there in Southeast Asia and the rest of the world. To make matters worse, there are many of these underserved communities who are affected most when disasters happen, when flood situations happen, and many climate issues related to water has regularly been happening. And Asia is one of the places that is being hit the most. So many of the infrastructure for water solutions that have been painstakingly built over time can be just wiped out like this overnight because of the vulnerabilities. So because of this, we decided three of us, we came together in 2014, decided to do something about this. We started Waterroom to develop decentralized water solutions that would be easy to deploy, highly accessible for such communities that are underserved and disaster hit. So the first thing we did in the first 3 years was really to go down to the ground, conduct a lot of interviews, and understand from the locals what is their way that they're trying to solve these issues and how can we best come up with solutions. And we spent the first 3 years making a lot of mistakes. We're trying to build a lot of these different prototypes. We were hoping to design and develop a water filtration solution that would integrate into their day-to-day lives in a simple manner, yet at the same time, it's something that they are willing to use on a day-to-day basis. So many of these places across various parts of Asia, but eventually when we were deploying all these different solutions, for the first 3 years, we kept failing. And mainly is because we brought in the mindset of our own context of here being in Singapore. We thought that maybe producing a solution that is more robust, that looks like it can handle that kind of rigor. It turned out to be too big, too bulky. One of our teammates, when we were carrying it down, actually carried it in an awkward manner, had slipped disc and had to come back with a surgery. And we realized solutions like this just are not accessible for communities that are so far-flung and hard to reach. Then we modified the solution to make it much more lighter, portable, but it became too slow. We put in a lot more pump-based solution subsequently, but that turned out to be too complex, even though we had an entire instruction sheet placed in front of the table where the solution is. But it turned out to be a white elephant when people are not using it after we came back over a week or 2 weeks later. So eventually, as we are about to give up, one of my co-founders, he saw somebody in the village pumping his bicycle and thought, why don't we just incorporate what they are typically using and a universally understood action of pumping bicycles with water filtration membrane technology? And that became our aha moment to give birth to a bicycle pump inspired water filter design. We brought this prototype down to the Cambodia wells and in front of the wells and started to pump, and immediately people understood what it was about, how it was able to filter water, and they started to bring their buckets and pails to queue in front of that. And we knew that we were somewhere there in terms of getting a good solution that could be adaptable, well adopted into their day-to-day lives. So that was the system that we eventually rolled out as our first flagship product, which is able to provide safe drinking water according to WHO standards, simple to use based on this intuitive design, swift to deploy into hard to reach places because of its form factor, its size, its weight, and yet we can still retain a very affordable pricing, which is be able to provide drinking water from the system at less than $2 per person per year. Now, this is an example of how it's used. This is in Bangladesh, in one of the Rohingya refugee camps. We carry into site, find a water source, which is groundwater, surface water, start to pump, and within 5 minutes, you get 20 liters of clean water. And that's sufficient for at least one person to, if it's an emergency situation, a family can have sufficient water for that day. If it's a place where they are developing, they have existing infrastructure and we're trying to provide water for a longer term. For example, in the rural communities, we can integrate the same solution into their water tanks, and this becomes a more effective way so that you don't have to use hand pump all the time. Because when we rolled it out, we realized that some people are just giving us feedback that they can't afford to keep pumping every day. It's manually tough and physically exhausting over time, even though we've already made it such that it's as simple as possible. So today we have been able to roll this out across more than 40 over countries for many communities in rural and disaster hit areas. So for example, some of the disaster hit areas are Vanuatu, the Myanmar situation where many of them are running in between the jungles, and also even in Ukraine. We've since been able to reach out to 350,000 people with the solution by partnering more than 50 international and local NGOs across the countries. And we're thankful to be able to make water much more accessible to these communities based on the price points and to bring it down to that 1.3%. Of course, we have to use some form of blended finance to provide the funding support with both the CapEx and the OpEx, but eventually we are able to, in combination, provide this at less than $250 per person per month. So our mission is to continue to bring forth these solutions across to 30 million people. Our aim is to really improve their life, living and livelihood, because we see that water is intrinsic and linked to many of these aspects. We're thankful for the opportunity to be featured on the CoAccess platform, and we are in the midst of raising some catalytic capital for the work of scaling our work into places like Indonesia and Philippines. So I invite you to check out the listing on CoAccess, and thanks for your time today, and happy to hand it over to the next speaker.
Thanks, David. Thanks so much. Yeah, like David said, if you want to learn more about WaterRoam, my colleague Wei Jun has actually put in details on how to access WaterRoam's profile on the CoAccess platform if you'd like to learn more. Thanks again, David. Up next for the second impact opportunity that we'll be presenting to us, we have Edward, who is founder and CEO of Reach 52, to share a little bit more about the critical work that his startup is doing around access to healthcare and also addressing key challenges around climate-linked health conditions. So over to you, Edward.
Hello, can you hear me?
Yep, we can hear you.
Excellent. I'll just share my screen. It should be all right. Excuse my messy desktop. Should be coming through now.
Yep, we can see.
Excellent. Well, yeah, firstly, echoing David's comments. Oh, sorry. Just stop sharing my screen and turn do not disturb on because the team are messaging me. Thought I put that on before, so now I'm getting all the notifications come through. Give me a second. Sorry about that. Well, yeah, firstly, nice to see you again, David. I think we met many years ago in one of the earlier startup accelerators. Yeah, thanks to Coaxis team for organizing this and the work that you're now doing to sort of take the baton forward in the Singapore and broader impact community. Hopefully you can see my screen now. Just checking.
Yeah, all good.
Okay, great. Just checking. Yeah, so thanks everyone. Thanks for listening. Yeah, really interesting to hear about the JPAL work as well. And in a way, quite glad I'm going last because multiple themes picked up already. Links to agriculture, linked to water are kind of picked up in some of what we're thinking about and doing as well. Yeah, unlike David sort of did an intro to the problem first and organization and solution second. I'm kind of going to do it the other way around, a bit about Reach 52 and sort of how our climate health journey started and then, you know, sort of finishing up with some case studies. So kind of, yeah, other way around, but same content. Yeah, as already mentioned, yeah, I set up Reach 52, taking our name from the fact that over 52% of the world, 4.5 billion people, can't access essential healthcare. So, yeah, about half the planet, according to the World Health Organization, can't access everything from basic medicines through to basic health services. Core of what we're doing, again, intro to Reach 52 in general, we're doing a lot of localized data collection. So we work with health workers, we work with people pretty much exclusively in rural areas to survey their own community's healthcare needs. So we're speaking to residents, house-to-house surveys, pharmacies, doctors, etc., to build up local insights. Based on that and sort of based on the community needs, we run health promotion campaigns. We've worked across about 20 health areas, from diabetes to dengue to nutrition to COVID, whatever. And that can be group events, one-on-one, posters and flyers, range of different engagement mechanisms, but sort of localized health promotion based on localized healthcare data. And then lastly, especially noting, you know, a lot of healthcare is private in you know, many countries, including many emerging markets or, you know, developing countries. We also sell and distribute affordable products. So working with pharmacies, working with clinics, often medicine or health products are too expensive, even if they're generic. So we look to bring in affordable distribution as well. Sometimes these services or these functions of our organization are all together. You know, we do all three for a project. Sometimes it might just be one. We might just be distributing medicine. We might just be doing the insights, but they're the three core blocks. In terms of how we make money, I just always put this in. We do make a bit of money on distributions. We see ourselves as a product distributor. We also get some of these health promotion or impact campaigns funded. And what we see is by having the products and sort of investing in awareness, that also helps build product demand. So we'll talk about a case study later. We're doing awareness around dengue. We're also selling, you know, dengue prevention products. So by raising awareness around dengue, that's good. It also creates some sustainable revenue as people access the affordable products as well. Yeah, right now we have about 60 products in market, so a range of medicines and so on. And we'll improve about 6 million lives this year alone. So 6 million beneficiaries, users of products, people, you know, getting screened at one of our events, something like this. Just markets wise, I put this one in, sort of just also sharing. India's big for us. We're pretty much nationwide. So we sell products in about 72,000 pharmacies, 400 distributors. We have about 300 people, staff in India. And based on our margins, we're doing about 10,000 screening events per month. So yeah, we screen about 700,000 people, 500 to 700,000 people a month in India. And that's entirely self-financed through the distribution margins. We're also pretty much, focusing on East Africa growth now. We've actually just started to register our medicines and products in Zambia, Zimbabwe, Mozambique, countries like this. And then we'll be looking at West and Central Africa later. So Singapore headquartered, Philippines and Indonesia first. But yeah, now India and beyond is our target. To do a lot of this, I think this is the final intro slide. We do a lot with private sector, so we're often negotiating discounts and helping partners sell products, and they're funding their public health campaigns. But we also look to do a lot with innovation partners, data, research, pilots, and so on, and also with development partners. Some of our biggest funders for the purely sort of health promotion side are, big donors like you see on the screen. Actually, last intro slide I lied. But yeah, what we're seeing, and this will be sort of tying into climate and health, is really great health outcomes. So you have affordable medicines, you're doing the health events. We see reductions in hypertension, reductions in NCDs or adherence to NCD treatment. Health workers improving knowledge, mothers taking actions. We've worked across a huge array of health areas, and yeah, really passionate about the impact of that and what happens if you have affordable, essential products with, sort of authentic health promotion, education, screening, and so on. And yeah, as mentioned, we work exclusively in rural areas in the 7 countries that we currently operate. Linking to climate and health, yeah, I mean, this is one of those things, hear it getting talked about. We've done a lot in what I'd call traditional health, as I say, nutrition, vaccines, diabetes, whatever. But yeah, I read the Lancet Countdown report, and I figured many people on the call might be somewhat new to the field. So if you haven't read this report, there's been multiple editions now. I really do read that. If you don't have time, I put it in ChatGPT for you, and you're more than welcome for my slides after. But you look at the climate and health intersections, extreme heat waves, heat exposure, limiting outdoor work, air pollution, PM 2.5, we've heard about that already, won't repeat it. Big rises of spread of infectious diseases, more vector-borne disease, dengue fever, transmission globally. We're now getting dengue in Canada, I think I read the other day. So mosquitoes going northwards. Droughts, water insecurity, food insecurity, or the opposite, floods, extreme rains, and so on. And yeah, lots of mental health challenges, and I'll touch on that later as well. But yeah, lots of climate health issues. But at least in my view, they're health issues that we've treated standalone. Mental health, for example, isn't new. It's now how do we adapt these health programs or these health thematic areas to the climate emergencies. Yeah, really recommend that report if you haven't read it and you're interested in this space. So yeah, we started off by doing some research. I mean, we don't see ourselves as a research company, but we try to ground everything we do in, localized insights. So we trained community health workers to do some surveys and health education. Sort of 70,000 residents in India, 46,000 residents in Kenya, 43,000 residents engaged in South Africa. I put this quote in, which really ties together the previous presentations quite well. I mean, one thing I took away from this is this research that we did is the intersectionality that comes out of this, right? So we were talking about health, residents talking to us about vegetables, food insecurity, extreme weather, bore wells, and water levels declining, so lack of access to water, as per David points. And then they're looking at different crops, so we're talking about income and livelihood, and all this kind of came from that ask about health. Looking at some of the results, 79% of residents said they'd experienced 1 or more extreme weather events, 61% with 1, 17% with 2, so significant. Of that, heavy rains and heat waves were the sort of top issues. And we found that often mapped to the sort of news articles as well. So the data we had sort of mapped to publicly available media, which we thought was quite interesting. In terms of the impact of that, crop damage, loss of family members, shortage of clean water, damage to properties, and loss of livestock is really key. I'm aware I'm at time, so I'm just going to speak a bit quickly. Apologies. But yeah, lots of impact. And for what it's worth, you're welcome to these slides for what it's worth. So if you did ever find this useful, we'll share it after. Just drop me an email. But I will race a bit now to try and keep the time. But yeah, lots of issues and impacts. And yeah, as mentioned, we found that the real sort of headline impact in a way was mental health. So when you have heat waves, 33% had experienced mental health issues. Definitely one of the most frequent issues we saw. You wouldn't necessarily think really hot mental health, but I've read about this theoretically, and we really saw that come through in some of our research as well. And then yeah, interesting with the sort of, I think this is penultimate slide. Yeah, what we did about that, we saw vector-borne disease, so we started thinking about how do we do health promotion campaigns around this. We've trained health workers, stuck up posters and flyers, looking at a dengue warning system, Facebook chatbots, really thinking about how do we take these concepts and this research, turn it into programs. So yeah, in this case, we engaged 226,000 people. We saw health worker knowledge improve. 23% of people had sufficient knowledge on dengue before. The health workforce got it up to 78%. The community awareness was more like 28%, and we got that up to 74%. So by relatively basic tools based on local needs, really saw significant jumps from 25% good to much more like 75% in dengue specifically. And we've done similar things in nutrition and so on as well. Final comments, just put this in. I just got back from New York and, United Nations General Assembly, Climate Week, this kind of stuff in the past few weeks, and then on to Germany. I would just sort of leave with some comments. I sort of feel like I went from a reader to first-hand believer. Time is now. This is right. This is real. Funders have to step in. We should be stepping in as innovators, yes. But no more silos. There's already too much siloing in healthcare and SDGs. So how do we think about sort of climate and health being embedded within systems versus try and build a new system? I think we need to also talk about real programs, not just the theory. What is climate and health? It means different things to different people. The needs are different in different communities. So really turning this into real health programs is sort of key for me. And how do we integrate it into an existing strong system? I find quite a lot of focus on climate and health at the moment, but if your health workers aren't trained, you don't have good data systems, your primary health facilities don't have a doctor or a nurse or medicines, I mean, it's kind of a bit like, so what, So yeah, final thoughts, just in terms of the wider ecosystem and how we should all work together to tackle these complex issues. And I'm done. Thank you. Sorry again for being over.
No worries. Thanks so much, Edward, for your sharing. And thanks also to both actually Impact Opportunities for taking the time to share more about the work that they're doing. Hopefully it's resonated with some of you in the audience as well, and you feel more inspired to support them and others like them as well in this space. So for this last segment, I'm gonna slowly bring up the speakers from J-PAL back onto the screen, as well as David for Water Roam for the last segment. So for this last segment, I'll be posing some questions to the J-PAL speakers as well as to the Impact Opportunities to bridge together some of the case studies and the literature that J-PAL shared earlier with the work that the Impact Opportunities are doing on the ground, especially around impact measurement and assessing impact. So I'll just get straight into it. David, if you don't mind, I'm going to start with you. So as an impact-driven startup or social enterprise, it can be difficult to choose what intervention to prioritize, especially if you're operating in a space where different impact areas intersect, like climate and health. So can you maybe elaborate a little bit more on your methodology for impact? So for example, what key metrics that you focus on? I think you shared a little bit already in your presentation, and how you track and prioritize these different outcomes as well.
Yeah, thanks for the question. So in regards to the impact that we typically will track, firstly, if we look at the theory of change, our immediate outputs are really about the number of filtration systems that we have sent out there, and then how many people we are able to serve using these filtration systems. Typically, we would assess whether there's an improvement in the SDG 6 and the level of basic water supply from moving from where they are. Maybe they're using a unsafe water source all the way to something that's basic, or even to a safely managed water source. But we want to measure and ensure that they are moving up that ladder when it comes to SDG 6. And looking into the further outcomes, which is a longer term, within about 6 months to a year, what we are trying to focus on is the sustained use of the system, because there are a lot of solutions out there which maybe it works for a while, but subsequently it may not be used. And so we use various methods to measure this. One is the volume of water as a proxy of whether the solution is constantly being utilized, and based on the average consumption per person, that would be an indication. Sometimes this is tracked manually by the water meters. Certain places what we're aiming to do now is to move towards a more IoT remote basis. But a lot of people would then question us, how do you have funding for such a solution to do remote monitoring? That's something that's expensive. We're trying to integrate the utilization of carbon credit accumulate the ability to clock carbon credits from the deployment of water solutions that provide water without the need for boiling and carbon emissions, as a means to be one part of this blended finance to support the monitoring. So the need to adhere to frameworks such as the gold standard and some of these carbon standards that help us to then clock for a DMRV, what they call DMRV, digital measuring and reporting and verification. That's something that we are building in as part of enhancing the kind of monitoring that we have. Yeah, so these are some of the frameworks and aspects that we monitor to provide both ensure the longevity of the impact, as well as the funding aspect of supporting the funding for this impact measurement.
Great. Thanks so much, David, for answering the question. And I think since we're on the topic of impact methodology and the frameworks, maybe I'll throw the next question to our friends at JPAL. Can you share a little bit more about the literature or research, or maybe some other case studies that you didn't bring up earlier, that you've conducted where the dollar can have the most impact, especially, like I said, in impact areas that intersect with one another?
Sure. I can give a quick example, and happy to have any of my colleagues add a complement to that. One of the interesting things that we're able to do with RCTs, or randomized evaluations, is that we can have a pretty precise measurement of what was the cost of how much did each dollar go into saving a life, or reducing emissions, or whatever the outcome that we care about. And one of the kind of group of interventions where we find kind of the highest cost effectiveness is in payments for ecosystem services. So a lot of times when we're trying to regulate, change people's behavior for some kind of pro-environmental behavior, we think about, command and control, like trying to impose fines. And, a lot of times there's difficulties in enforcing that, and especially in low capacity settings. But another way to do it is actually just to pay people, give cash transfers for pro-nature, pro-environment behavior. Many times people think about that in terms of deforestation. So giving communities that are, using logging or solid fuels or things like that, we give them cash transfers to stop deforestation, and we have studies showing that actually works when you design the contracts carefully. But also we can apply it to reducing practices like crop burning, which is one of the major sources of pollution in the world, especially in India right now. But it's all over, in Latin America, in Asia, and many other parts of the world. Farmers burn their crops because it's the cheapest way to go, and they don't have the equipment or the know-how or the motivation to do otherwise. And so we found that through this payment to stop farmers from burning crops, we're able to get a life saved for $3,600 to $5,400 is the cost. And so it's an incredibly important intervention. And I think the detail here, and this is the last thing I'll say on this, the detail is not just doing a payments for ecosystem, just a direct cash transfer doesn't necessarily work in the classic sense, because usually those contracts are designed such that the farmer has to show first that they change their behavior and then they get their cash transfer. And what we did in this study that was really new was we said, okay, we're going to give upfront payments, 25 to 30% of the total payment they'll get upfront. And that's going to build confidence that they're actually going to get the money, and then they actually change their behavior much more than in the classic sense. So, these small innovations can have a big effect on actual, the cost effectiveness of the intervention in the end.
Great, Andre, thanks so much for sharing. Sham or Harris, on the J-PAL side, do you have anything to add?
Just a quick number to substantiate also what Andre said in terms of payments for ecosystem services to reduce deforestation, is that we can see that this is actually extremely cost effective, to the cost of about $0.46 per ton of carbon that is delayed from entering into the atmosphere. That's how low the cost is in order to prevent deforestation, and the knock-on consequences are immense.
Yeah, thanks so much. And I think, it's interesting that, that this particular intervention targets behavioral change for, some of the beneficiaries of these solutions. But maybe, Edward, the next question that I had in mind is on the funder side or the investment side. All the case studies that were shared today has shown that with the right support, whether it be from governments or through partnerships with other social enterprises or civic society actors, but also especially through funding, we can really unlock these impact potential in the climate and health sector. But as a startup founder yourself who is working in the climate X health space, can you share your experiences in the current environment in terms of funder engagement, whether it be in Singapore or in some of the other regions that Reach 52 is working in? What are the challenges that you're facing in terms of fundraising or, like looking for investment in your startups, and whether or not the donors or the funders are really understanding the impact in this space?
Yeah, so thanks for that. I was processing as you were talking. Well, almost like talking on climate and health first, and then more broadly on Reach 52/region, etc. I mean, climate and health, yeah, I was in UNGA Climate Week, this kind of thing. Really, we are passionate about this. As I say, we kind of felt the problem, and then we're trying to source funding. Clearly, there's a lack. It does feel like there's a lot of policy, white papers, and so on. And please do fact check me and correct me if I'm wrong on this, but I personally don't see many climate and health big funds. There's no global fund or Gavi for climate and health. There's not that many grants coming out, right? So there seems to be a lot of interest, noise, acknowledgement, political declarations, UNGA, United Nations, etc. I don't see that many grants. That said, one of my biggest realizings of climate and health is that we use this kind of catch-all bucket, but the health impacts are nutrition, vector-borne disease, access to facilities, training your health workers better on the climate health intersections. All that exists in terms of funding, right? You have Gavi, you have Global Fund, we have funding to train health workers, etc. So I think for us, we've kind of taken the passion for it, if you will, and then tried to fit it within existing funding structures. So a lot of our climate and health work is funded by nutrition companies, because one of the impacts is, malnutrition, food insecurity, etc. Therefore, Bayer funded it, big agricultural business and consumer health nutrition business, not pushing product, just, tangentially linked to their business interests. So thinking about climate and health in terms of specific health issues and then kind of mapping that up to specific funding sources is how we've approached it. Funding in general, yeah, it's tough at the moment. Yeah, for all the startup founders out there, yeah, keep pushing. It's not easy for any of us, right? It's a tough market in general, and a lot of funding is going to pure climate, rightly so, net zero, carbon reduction, etc. So health in general is having a bit of a tough time. I think for us, yeah, think broad. Our biggest funders are UNDP and Johnson & Johnson, right? You just have to be a bit creative in times like this and get your head down and crack on. Investors, personally, I don't think get it at the moment, but bluntly speaking, we're told we're too broad, we're doing too much. I'm just like, well, actually, we're just trying to give good primary health to rural communities, and that has many facets. So yeah, I guess just also making sure you speak to the right investors that get your vision. We're trying to do primary health work, if I put it really simply. But yeah, it's a bit tough, especially if you're trying to do many different things in the sector. Yeah, I'll pause then. More to say, but I'm going to pause.
Great. Yeah, thanks, Edward. Actually, that tails into nicely the final question that I had to pose to JPAL. You know, like you said, different investors or funders are looking for many different things. Like you said, you have to get creative with it when you're approaching them with a startup or a social impact or impact project. And given that impact is often very subjective, maybe for the JPAL team, can you share some insights into how, you know, like based on the existing case studies you have or the existing literature, should impact opportunities like Water Roam and Reach 52, as well as on the funders and the investor side, kind of level up the standard for impact measurement, whether it's even possible to standardize that across, you know, like an intersection like climate and health. Open to anyone on the JPAL team, yeah.
Yeah, I'm happy to kick this off as well. So I think, you know, as a network where we see our value add is talking about randomized evaluations, and you know, but we recognize that it's definitely not the only way to measure impact. I think it can be very useful in some cases when you have the resources and the time to you know, actually start these collaborations at the beginning of a innovation cycle, and there can be tremendous payoffs in terms of what I discussed earlier, showing, you know, the per dollar effect of your intervention in a very convincing way. But I think in more generally, I agree in climate and health. This was a big discussion last week at the World Health Summit, where a lot of, you know, leaders in the health space said we have to bring climate into the health conversations, and we have to actually break the silos between the climate and health spaces. And that's something we're trying to do, I think, hopefully in the next 5 years of our initiative, and bringing in kind of researchers that are working in the health space to work more with development economists and trying to get these collaborations off the ground. But I think back to the evaluation part, I think, you know, RCTs and randomized evaluations is one part of the spectrum, and there's a whole range of types of evaluations that can be very useful as well.
Great. Yeah, thanks so much. Sorry, I know we could probably go on for a little longer, but I'm also conscious that we're running a little bit over time. So maybe I'll just say thanks so much to all the speakers who joined us today, Andre, Sham, and Harris, for sharing your case studies and for sharing a bit more about JPAL, and of course to David and Edward, who took the time to, you know, really talk about their solutions that they're working very hard on as well, and the kind of support that they need too. So with that, it brings us to the end of our webinar. We do encourage you guys to stay in touch with the Coaxis team. So you can reach out to us via the Coaxis platform directly by signing up, or you can also connect with us on LinkedIn, or we just recently launched a bi-monthly newsletter as well, where we'll be giving regular updates about, you know, collaborations like today's webinar with JPAL, as well as updates about new impact opportunities that are onboarded to the Coaxis platform, as well as progress with the existing opportunities that are on the platform itself. My colleague Wei Jun shared previously in the chat box as well that you can find Water Roam and Reach 52 directly on the Coaxis platform. So you just have to sign up. It's free for everyone to sign up, and you can look through David and Edward's profiles on the platform, but also we have over 80 more other opportunities on there, working on a range of different issues and topics as well. So yeah, we really hope you enjoyed today's webinar. And again, another thank you to our JPAL speakers. I know Andre is joining in from very early in the morning in the US. So thank you so much for making the time. Of course, David and Edward as well, thank you so much for your time too. And thanks to everyone who joined us today. Again, apologies, we ran a little bit over time. We'll make available the recording of the session if you want to go back to it, and also the slides from our speakers today. So just keep a lookout from a message from us with all the follow-up resources as well. Thank you all so much.